Hi, my name is Riley Gray. I'm 16 years old and I'm 5 months post-op of periacetabular osteotomy. I began having pain in my knees, which my doctor told me was some patellar tendonitis, and through my exercises it got better, but slowly over time I was noticing some more pain in my hips. My hip pain was more intermittent until about my freshman year of high school when I was playing 14th year club volleyball, and one of my teammates had been also complaining of back pain, knee pain, and hip pain, and went to see a surgeon specialist, and they were diagnosed with hip dysplasia as well. We were always hip buddies and we always got our hips wrapped together. So when she had surgery on her hip and we were having the same symptoms, I got kind of nervous about it. The pain kept staying sharp and became more consistent. And after that, we visited a sports medicine specialist. The sports medicine specialist referred me to an x-ray in order to see what was going on, see if my anatomy was right. After having me go through an MRI, he told us I had a severe labral tear, and I was really shocked because I successfully played through 5 seasons of sports without having super severe pain, so I didn't expect such a severe surgery requiring diagnosis to not be constant pain or prevent me from doing everyday activities. We walked into the pre-op room and I got dressed in my gown and my scrub cap, and I was holding my blankets and a couple stuffed animals and just talking to my mom. And I remember her posting an Instagram story about it. My nurses were really nice, and when taking care of me, they always made sure I was comfortable and really stayed on top of my pain meds, which helped. And they were always lively when they came into my room, which made it so much easier post-surgery after having a really big procedure to just kind of forget about the whole thing and have someone who's like really kind and loving taking care of me while I'm going through some of the hardest days of recovery. Working with my physical therapist is helping me get back into sports as gradually as my hip will let me. I'm really grateful for the team at Sky Ridge who's helping me get back into the sports and everyday activities that I love to do. I looked into volunteering at Sky Ridge actually before my surgery and began volunteering in last November. I was working at the front desk, and it was a really exciting experience as someone who wants to be a future healthcare provider to be able to feel like I'm in the medical field. And now, having moved up to the 3rd floor post-surgery, it's super rewarding to talk to the patients on the 3rd floor that had the same surgery that I did and give them helpful encouragement, feedback, and tips. And I just love seeing the impact that my journey and experience has had on them.